Hi, my name is Bobby Ghaheri. I'm an ear, nose, and throat surgeon with the Oregon Clinic and the Center for Aesthetic Medicine. I'd like to start off by saying that these thoughts are my own. They're not part of my organization. I think if you follow any physicians on Twitter, you almost always see that in their bio profile, but really they are my own. Feel free to email me or tweet me with any questions or references that you need for anything I bring up today. I'm here because I want to point out very bluntly that medicine and social media have already collided. The only thing that's going to happen in the next 5 years is you're going to see a more ubiquitous acceptance in society between social media and medicine. I think aside from a few physicians who really have taken this by the reins, most physicians still think that this is a fad. They think that social media will pass and that everything will return to the way it was before it started, and I'm going to tell you that that's absolutely not true. I'm here to ask the questions that really will hopefully spur social media on in terms of becoming a more robust and mature platform for interacting with physicians. But more than anything, and this is really to get me more followers, so if you go ahead and just follow me, that'd be fair. I'm just kidding, that's not why I'm here. How did I get here? Well, I started doing this under the platform for advertising. I'm part of a medical spa. I had this vision of tweeting out deals and events and specials, and this floodgate of Botox would open into my office, and it didn't happen because nobody wants to interact with an institution. This was brought up earlier. People want to interact with a personality or someone they can identify with, and so I wanted to build a brand, and the 32 people who were following me really didn't care because the message didn't get out there. And since I have other partners, I can't really take on the med spa's voice because I don't want to put words in their mouths. And so nothing really succeeded until I started tweeting from my own handle. I think the single most important reason for physicians to embrace social media is patient access. I think that even if that person is not in your community, they're in Australia, the message is still clear. If you put out information and it gets circulated, it may apply to somebody in your community, and so that's how you can draw people in. I think that if you realize I've done cosmetic surgery and procedures and sinus and cancer surgery on people who first asked me a question on Twitter, and they never probably would have ended up in my specific office, and some of them travel outside of their community to get to me because they feel like they already know who I am. I don't consider it billboarding. I don't consider me any better than anyone else in the city. I just feel like I'm more accessible to most ENTs in the city. I think when patients investigate an issue in a non-threatening manner, they feel more comfortable, and I think the current generation who embraces Twitter has maybe a different outlook on what privacy is compared to the older generation, and as that older generation moves on and the newer generation who really takes Twitter on, I think that you're going to see this become more common. I think with patient access comes patient education, and this is the part that I really like the best. Even to those patients who I'll never see, I think debunking myths and giving my perspective and really pointing people to resources in their community if I happen to know someone, it really is really very helpful. I think when people see you as an enthusiastic and reliable and involved physician on Twitter, they believe you and they trust you, and that reputation follows you. I think you look at people like James Beckerman locally. He was on Twitter, he's now on formal television media, he's in print media with a book, and he's really done a great job at becoming that modern physician and that model of what I expect to become more and more common in the future. I think also part of it is comic relief. Even though I'm not anonymous, I do follow some anonymous doctors who really say the things that, even though I may think occasionally, I have to restrict myself from saying, and while they're out there, it really provides some sort of relief from otherwise a stressful job. I think coming full circle, when you look at the part of my practice that got me into Twitter, which was cosmetic aspects, it didn't work until I built my own name. Once I built that name, I began to advertise. So when I get a cancellation in the office, you'll often see me tweeting out X% off, come in at this spot, and people fill those spots. People are looking for that. I think in the Groupon age, you're starting to see a lot of bargain hunting, and where I provide a sense of reliability and access that most patients don't have. Most importantly, again with education, in the realm of cosmetics, there's a lot of really crazy ideas out there. Not only Botoxing 8-year-olds, but Botoxing in the wrong place on the face or using the wrong product, really can get people into trouble. And so that's where I really think I've become helpful to many people, even outside of Portland and Southwest Washington. So great. Twitter's awesome. All doctors should do it, right? Well, not so fast. There's definitely some downsides to it. A big part of that is what can happen legally. Well, with HIPAA and the Health and Privacy Information Act, you have to be very, very careful. One wrong keystroke, if you hit a public reply instead of direct messaging something, that can have pretty catastrophic consequences. Even though I may not know you, I don't consider that a doctor-patient relationship. But if I've met you on Twitter and then you end up in my office and we do have a formal relationship and you're asking me post-operatively, is this normal? And I'm saying, oh, that nose job you had really, and then oops, you've really violated HIPAA there, and that happened to a colleague of mine. I think if you remember last year in Rhode Island, there was a emergency department physician who on her Facebook post posted, even though without naming the patient name, very specific details about a trauma case in a smaller community, and the members of the community were able to identify specifically who she was talking about, even without her mentioning a name. That's a HIPAA violation. So she was fired from her hospital, reprimanded by her state medical board, and fined. And that's the kind of stuff that can happen if you're not careful. I think that we're taught as physicians to be very, very careful of what you're talking about in an elevator and in a hallway, and I think Twitter has to be done in the same way. I think that there's a noticeable difference in the attitude between this generation and previous generations, but that's not an excuse or license to really say whatever you want. Another big part of this is professionalism, and so what part of my Twitter account is me as Dr. Ghaheri, and what part of my Twitter account is me as a husband or a father or a professional swimsuit model? I mean, all of these are really big parts of my, no, they're not big, but, you know, that's a blurry line. And if you cross that line, it may confuse not only your target audience, but it may confuse the people you know in your personal life, either professionally or personally, and that's a really big no-no. I think that it's mandatory for every single healthcare organization to have a social media policy, even if it's vague, because it gives them a foundation to enforce it if necessary. I think if you realize that the American Medical Association last year put out a social media policy, it's vague. But what it allows us to do is to not only police ourselves as physicians, but to have that discussion in the event that something happens. And it allows this system to become more and more mature. So what can happen? What are the bad things that can happen? Well, litigation. I haven't heard of a specific, you said this in Twitter, so we're going to court case yet. But I'm sure there are instances when something has happened between a physician and a patient, and something has been said on social media that can then be incorporated later on, and that's something you always have to be aware of. You can lose your credentials, as we've talked about. You can get terminated by either a hospital system or your organization. It can impact your relationship with insurers, and if your goal is to get out there and get well known and then you stop getting paid because your insurance company thinks that you're bad-mouthing them or misrepresenting them, that's a problem. And finally, people can think you're a jerk. That's not really why you're here. You're all here to learn about how to access people and to connect, and you don't want to come off in a poor way. How do you prevent that? Well, peer-to-peer policing. If I see something that a physician or a medical student or a resident says, you bet I call them on it. And I do it often, hopefully direct message, but if they don't follow me, I have to do it publicly. And I think that's the kind of thing that has to continue to happen. Disclosure is a big one, and even though I say these thoughts are my own, some physicians take it even farther. If you look at Hisham Rana, under H. Rana, he has a gigantic disclosure page that he links to in his profile, and I think that's the kind of thing that you're going to need to see more and more often. But more than anything, what's going to make this transition and incorporation of social media in medicine is time. More and more people need to know about it, more and more people need to accept it. In the end, social media is here to stay. It's not going to leave, and it's an increasingly common way for people to connect with not only physicians and practitioners, but medicine in general. And I think that it'll take a handful of visionary physicians and meetings like this to help spur that along. Thanks.